Cindy Cantrell with Compassionate Journeys, conversations about home care and hospice. Today we're speaking with David Zoffoli, who volunteers at Merrimack Valley Hospice in 3 different ways. He's part of the Keepsake program, which makes memory bears and pillows from clothing of the deceased. He offers a weekly 20-minute virtual calm breathing session. And he co-facilitates a support group for anyone in the lgbtq community who has experienced a loss. The group meets on Zoom every other Tuesday night from 5:30 to 7. David, thank you for joining us.
Thank you, Cindy, for having me.
Now, David, I remember that you were introduced to Merrimack Valley Hospice through your late husband, Steve. And I was hoping that you wouldn't mind please sharing a little bit about Steve for those of us who weren't fortunate to know him.
Thank you. I'd be happy to. Steve made me laugh every day. In fact, he put those into his wedding vows when we got married, and he brought it every single day. He loved to ride motorcycles, and he was a Snap-on tool dealer for most of his professional life. He began shooting photographs and worked as a volunteer with the Merrimack Valley Camera Club in North Andover. And he brought people on field trips, and everyone loved him because he was a funny guy in the room. And so yeah, I miss him every day.
Yeah.
I talk to him every day, and I don't think that will ever change.
What did he like to photograph most?
Well, I was, he loved portraiture. He loved taking pictures of people. And I was always the guinea pig. And I have way too many bad pictures of myself. But he also liked architectural photography. And like most photography geeks, he was, he loved nature. He loved, flora and fauna, and to capture a bird in flight. This was a passion for many photographers that he was friendly with. So yeah.
Yeah. I know that you donated a framed photograph taken by Steve to our Merrimack Valley Hospice fundraiser, and I was curious if you wouldn't mind sharing what it was about your and Steve's experience at our High Point Hospice House that led you to make such a generous donation and then get involved as a volunteer.
That's an easy one. Merrimack Valley Hospice came into our lives about a month before Steve died, and the customer service before and after his death for both of us was stellar. It was something that we looked forward to every week. I learned from a hospice nurse how to do the important medical things and all of that, but we also took advantage of free massages and free Reiki, and then after he died, I was in bereavement counseling for a year with the intention of volunteering at the end of that year. That was kind of like a rule to make sure that I got through all the first anniversaries of everything.
Yeah.
And so the day after, the day after 1 year, I made my first memory bear, which I could do without lots of volunteer training. Well, now I've been trained in bereavement, and I feel like I should have a PhD in bereavement because the training is so thorough, and the people are just so nice. I say if I went back to work, I wouldn't have time to volunteer. So yeah, I try to get more people involved in any way that I can to give back to Merrimack Valley Hospice because it's just a wonderful organization.
So basically the day you were eligible, you did it. That's remarkable to me. What was it that drove you? What was it that was so important to you to do it? Because so many people have such good intentions, but are overwhelmed or so busy with life, but you've really followed through.
Well, that's what I play on TV, Mr. Follow Up, Mr. Follow Through. And And I promised my husband
Oh.
that I would give back specifically to the Home Health Foundation in whatever way I could. Um, I I have a master's degree in curriculum design, and so I've done a lot of programming
Mm.
and event planning in my life.
Hmm.
And so I came out of the gate with maybe too many programming suggestions because Eric Redard, the volunteer manager, just didn't like. Okay, hold on. So but he said we'll get to that. We'll get to that.
Yeah.
And so eventually I was properly trained, and I said, well, I've also, taught calm breathing. That's what they call it anyway. It really is actor training because I taught acting for many years as well. And so it's about breathing deeply. And he said, oh, I think that'll be perfect. So we have a weekly volunteer support group that
Hmm.
has been going on for over a year now. And shortly after that started, I said, how about some, breathing? Let's do some breathing together. And so we have, volunteers, we have staff members. I've opened it up to some friends, and and I think Eric can tell us if it's available to the general public, which I think it probably is.
I've done it myself. It's tremendous, and I think anybody who's gone through this pandemic can use that exact program or something very much like it. I know it's
Yeah,
been tremendously successful with our staff. Thank you very much for offering it.
it's my pleasure, and it's 20 minutes out of the week,
Mm.
and it's like takeaway. You can do these exercises as often as you need them.
Yeah.
And for anyone who works at a computer, especially, should take a break every single hour and
Mm.
walk around. And if you take a few breaths, all the better.
Mm. And I'd like to please know more about the keepsake program because I've seen the bears, but I don't know exactly what goes into the program or the requirements, or really what it entails.
Well, the keepsake program is providing some kind of tactile product
Mm.
from the clothing of the deceased. And so I've made pillows, I've made small quilts, I've made
Mm.
a number of memory bears, and it really, if you have skill as a sewer, then you can participate from that end. For anyone who has lost someone, they can get in touch with Eric Redard, and he'll, take the clothing pre-washed and pass it on to me or to a number of other volunteers. So we never actually meet the bereaved.
Oh.
We work in our studios, um, but it's available to anybody. And I really thought that the program would get a little more robust considering the pandemic, but I think just the opposite has happened.
Oh.
People are a little afraid about going out, and you know,
Oh.
so. But we're all dealing with it, and I'm double vaccinated.
I am too, luckily. This is my first podcast without a mask. It's very exciting. um, I'd love to know more about the LGBTQ support group that you facilitate with our social worker on staff, Kara Cheek. And I understand that it's a facilitator led support group rather than group led. I'd love to please know the distinction and if you could share some of the topics.
Sure. Um, and so it's a Zoom meeting every other week.
Mm-hmm.
And I don't think Zoom or video conferencing is going to go away. I think it's convenient for a lot of people, and I think that people who are grieving, it's a little bit easier than having to drive somewhere, park, and and sit in a room with people.
Yeah.
It's more of a commitment, but with a video conference, it's easier to participate. So, a facilitator-led group versus a group-led group has a little bit more focus to it, and we don't have topics per se that we kind of roll out,
Mm-hmm.
but Kara and I are developing an understanding that LGBTQ grief, like the community, it can be marginalized in a way that brings up, old wounds. And especially, people who are in my generation, we remember a time when you had to be in the closet. Uh, and it's completely different now for anyone who is coming out. And so many of our participants are older people because their spouse or partner um, was old
Yeah.
and died. And so, uh, with a group-led group, it's a little catch as catch can, and sometimes people can take over the group
Yeah.
and uh, and hijack the group. And I've facilitated a number of different kinds of groups, and I find that if there is a leader to the group, it will give focus and therefore the participants more takeaway.
Yeah.
Uh,
I can see how
so
that would happen, and I can see how it would be very well intentioned, but that it could be very common.
yeah, it is, and it's only an hour and a half, and every other week, and so we want to make good use of the time without it becoming too off topic or
Sure.
off track.
Sure.
Yeah.
I don't want to get too personal, but I know that you mentioned, personal experience in the past with me with other groups. I'd love to know why facilitating this group was important to you, because as you're involved in so many things, you're volunteering in so many different ways, you know. But I feel like you are the best person for this, um, unfortunately because of your personal experience, but also because of your personal experience.
No,
If
I
that makes
totally get it.
sense.
I totally get it.
Yeah.
And that's exactly why I wanted to participate, because I lost a spouse of 20 years. And because that grief is not going to go away,
Yeah.
um, I, I thought that I might share something of my own experience with the group for their benefit. And apparently that's true. uh, because the people who have participated so far um, knows what they're feeling, and can speak to really nitty gritty stuff
Yeah.
about the grieving process. And so, for example, in the um, uh, in the first year after Steve died, I I was numb.
Of
I was
course.
numb for uh, a long, many months. I mean, physically numb and emotionally numb. And I didn't want to feel, basically, because feeling just felt too big. And so I read a couple of books and cried through every page about grieving, and cried through every page. And it was a very dark winter that
Yeah.
first year. And I thought, as a teacher, I thought I need to reflect on this, interpret it, assimilate the experience, and pass it on, uh, because that will be beneficial, I think. And so that's what I do.
Do you find that there are many groups for the community? Do you feel like um, this is especially needed in the Merrimack Valley area? Do
Well,
you?
that's a really good question. It's not unique around the
Okay.
country.
Yeah.
I have a couple of friends, as a matter of fact, who either facilitate or participate in two different groups in New York, and someone in LA and Chicago. And so major metropolitan areas have this. The Merrimack Valley, not so much. And so when Kara asked me if I would co-facilitate because of my personal experience,
Yeah.
um, I said, well, yeah. And because we're doing it on Zoom, we can open it up to, a wider geography.
Yes.
Uh, and So that's how we will make it more robust, with the help of the marketing department, and
Yeah.
and move forward with something. We want to keep it reasonably small, like under 30. Otherwise, it just gets a little, and then we might have to
Yeah.
keep it to 10 or 15 and have two groups or something like that. But it does include, the gay, the non-binary
Hmm.
communities, who have experienced a loss because of the uniqueness of the marginalization of those communities. And I think any disenfranchised community can relate to that. So I think of people of color,
Mm.
I think of,
Yeah.
uh, transgender people. Uh, we live with that kind of marginalization. Um, and so to define that and frame that, um, through words is a real step in the healing process.
Is it okay for us to talk a little bit about some examples of marginalization without saying anything identifying? Obviously, I know everything in these groups are protected, obviously. But I'm hoping that this podcast can be used for educational purposes as well, so that maybe anybody who's listening to this could have maybe a firmer grasp on some of the things that people go through. Some of the things maybe that they don't even haven't even considered are marginalizing, or people have to just added ways to suffer.
Yeah, yeah, it does bring up, other losses,
Hmm.
um, and of course it's been magnified by the pandemic. So you're getting all this input. I can speak from my experience without being too identifying, I think. Um, uh, I had to file a claim, um, with the Social Security Administration for my husband's death benefit,
Hmm.
and it was just a couple of months after he died, and so I was in that numb place. There's a lot of
Yes.
administration that
Hmm.
you have to go through when a spouse dies, and so I was doing all of that.
Yeah.
So I went to the office, and I had an appointment, and I went to the window, and I told her my name, and she looked down on glasses, over glasses that she didn't wasn't wearing, and she said, "You were married?"
Mm.
And I said, "Yeah." And I thought that was kind of weird, you
Yeah.
know. And I waited 2 hours past my appointment time, and I don't know if that was intentional or not,
Yeah.
but it sure did feel like I was sitting in the back of a bus.
Yeah.
And so I thought this can't be happening in 2018,
Yeah.
but there it was. Um, Another example is, uh, you know, one participant's partner died, and they weren't married, and but they lived in his loved one's home for 50 years together.
Oh.
And when he died, um, his partner's family wouldn't recognize their relationship, and and asked him to move out of the house,
Oh, his home of 50 years.
his home of 50 years. And so you think about that happening, and that was 2000, I think, 19 or 20.
Mm.
You think about that kind of thing happening because of an orientation, an LGBTQ orientation. It's like, wow, it's still happening.
Yeah.
Uh, and so, because we come from a time when we remember closeting, um, and the only way to meet people was at a bar, and it was, uh, we share that history, and in sharing that history and all we've come through
Yeah.
for equal rights, um, they say, you know, uh, what doesn't kill you makes you stronger.
Mm.
And at some point, you kind of say, I'm really strong enough. Really, I don't need to be any stronger.
Absolutely.
Um, so I think that's one reason that the all-inclusive Merrimack Valley Home Health Foundation and the hospice was just a joy because absolutely no judgment.
Oh, I'm so relieved and glad.
Yeah, I
Although
mean,
it's what I've experienced too in terms of, you know, just equality all the way around. Please continue. Sorry.
no. That's this is a conversation,
Yeah.
as you said. So um, I'm very grateful to the foundation, uh, and I think that people who participate in the programs that are offered free of charge
Yeah.
um, are very lucky, and not enough people know about them. And I live in Haverhill, and so there was always a good word on the street about High Point House,
Mm.
and so I started exploring that a few months before Steve passed, and I found them to be amazingly ready, willing, and able to send people out to the house or go into High Point House, whatever was needed. And it couldn't have been a better experience.
Well, I'm glad to hear that, as hard as I'm sure everything was and still is, of course.
Well, it does get marginally easier.
Mm.
Um, I would say that uh, grief, you know, of a lost loved one never goes away.
Yeah.
There's always going to be a void because you can't stop loving.
Yeah.
Right? Just because someone dies, you have to put that love somewhere.
Yeah.
And so I put it out to the universe, and I put it out to my husband, who
Yeah.
tells me he's received that love by, all right, now I'm going to get a little weird, but I listen to the birds, right? Oh my goodness. And I see the hawk come back every single day. And, you know, you look for those kinds of signs
Yeah.
as a way to, stabilize yourself. I did. And I didn't realize it, but there are dragonflies, images of dragonflies and sculptures of dragonflies everywhere around High Point House. And I thought,
Yes,
what's
I've
that about?
noticed them. Hmm.
Yeah. And you know what they said? They're a symbol of a lost loved one.
Hmm.
And so my sister-in-law after her brother died, started collecting dragonflies and dragonfly everything. And she always, sends me a text or a photo of, a dragonfly that has entered her life
Oh.
in some way. And just this morning, she was on a walk with her grandson, and there was a garden stake that had a dragonfly and with the inscription, "Welcome, my friend." And it was laying down in her garden, and it wasn't there the day before. And so I said, Steve was visiting you today.
That's very sweet. That's
Yeah,
beautiful.
yeah, you got to hold on to those things. And that's what I advise people to do. Find a sign that you can live with.
Yeah. I think we've touched on this a little bit, but one of my questions for you was your perspective on why it's so important to offer a group for the LGBT community. And I think I'd also like to note that all of the Merrimack Valley Hospice support groups are free and open to the community and not limited to Merrimack Valley Hospice patients. Um,
Yeah. Yeah. I think that the LGBTQ community um, has a history of activism
mm,
and, uh, and necessarily fighting for what they want, like equal rights
yeah,
and marriage equality, uh, and so there is among us, there's a special something. I think, like any disenfranchised community, you get together and you have a shared history, you have a shared past, you have just because of your sexual orientation,
yeah,
and so that's why I think it's important to have a group specifically for that community. I think it's helpful, makes people feel a little more comfortable. I was in a bereavement group for um, uh, with a lot of straight people,
Yeah.
uh, and they didn't get it.
Oh.
Um, and it's just a feeling,
Yeah.
but there's a lot of, you know, right after a death, you get a lot of attention. You know, the day after, the week after, people bring over food, and then somewhere around 2 weeks, it all stops,
Hmm.
and you're suddenly left alone.
Yeah.
Uh, and so you turn to friends, you try to reach out to friends, but it's not easy to reach out when you're grieving.
Mm.
It's much easier to receive a call.
Yeah.
You know, people checking in, and you know, a lot of my friends who happen to be straight um, didn't check in,
Mm.
and I mean colleagues. You know, and so it was. You know, I don't mean to make such a sharp division there around sexual orientation, but there is something to it.
Mm.
There is something to it that makes me happy to be gay.
Yeah. I also wonder too if it's, I don't know, but I wonder too if it isn't also some people just don't know what to say. And I know we are still working on education piece in my communications department too, and in that if you bring up somebody's passing, you're not going to hurt the person who's lost that loved one. You're not going to remind them that they've lost the loved one. That sometimes they'll want to talk about the person and
Yeah,
so on. Um, Even when my husband, he's lost his parents, this is in no way a comparison to you whatsoever. But I know that I remember that point at which the calls stopped, and I
yeah,
remember it suddenly being very quiet, and I remember it suddenly being a little extra lonely, and I know that it wasn't intentioned at all, but I remember it suddenly being very odd. So I know this is not a comparison whatsoever, but I do recognize that, and because of that, I try a little bit harder in my personal life to not do that.
well, thank you.
Yeah,
Prizes to you again.
yeah. No, but
Well, you know what? I mean, grief is grief,
yeah,
um, regardless of anything. Grief is grief,
mm,
and uh, so anyone who has lost a loved one, and you could even get more specific and say anyone who has lost a spouse
yeah,
or anyone who has lost a child,
mm,
um, uh, share some mutual history, share some mutual experiences.
yeah,
And so to call that out with a specific disenfranchised group
yeah,
um, uh, is a, you know, is a faster 2 steps forward.
yeah,
That's what it is. Because there's shared history there, and because you can basically be yourself
yeah.
and
Right.
not apologize for anything.
Yeah. What was the photograph that Steve took that you donated to the fundraiser?
Oh, that was what was one of his favorites. It was
Oh,
a photograph of uh, Beacon Hill. Uh,
oh, lovely.
some beautiful gorgons, you
Hmm.
know,
Yeah.
and beautiful lighting. I mean, lighting is everything to photographers, and so it was one of his favorites. And you know, he won a lot of awards at the Merrimack Valley Camera Club for things. They had like awards every week or something, you know,
Yeah.
like and so I have this whole box filled with, you know, blue and yellow and red and orange, purple ribbons. And one thing that I did for Steve, he always wanted to be in a gallery.
Mm.
And so as a memorial service, I put together a show, a one-man show of his work.
Oh.
And it was frankly way too soon for me to do it. But he had so many friends and colleagues at work and, you know, at play. Uh, they needed a place. He was cremated, and so they needed a place to and a time to grieve together and pay their respects. And you know, I sent it out on social media, and I thought, all right, I'll plan for 50. as far as food and all of that stuff goes, and over 150 people came, and I was just surprised. Well, not really surprised, but overwhelmed. And I didn't know half the people that came, but he had made quite an impression.
That is
Uh,
so touching. I'm glad you
it was,
got that support.
yeah, it was a very cool show. And so when we can have a silent auction again at
Yeah,
the foundation, I still have, a couple of prints to give them.
that's so generous because those are things that you might, I don't know, you might want to selfishly hold on to. So for you to share those things, I think that's just remarkably generous. I
Well,
just think you're a cool guy all around. I admire you.
well, I think you're a cool girl. So, Mutual Admiration Society. And Lou, I think you're fabulous.
No, thank you. And all three of us are right.
Yeah. Well, I want to thank you very much for your time and being here today with me and sharing all this information. Um, I also want to remind everyone that Merrimack Valley Hospice offers support groups for grieving spouses and partners, adults and children, all of which are free of charge and open to the public. To register and learn more, call 978 552 4510 or go to merrimackvalleyhospice.org. And thanks so much again.
Thank you.